Hello out there. This is Dr. Shawn Pruitt, your community pharmacist. And if you're wondering who I am the owner of two pharmacies in Nashville, Tennessee, Pruitt's Discount Pharmacy and Pruitt's Pharmacy at Napier Clinic, which is where we're broadcasting from today. I am also the host of TV News Channel 5 Plus show Pharmacist on Call, which broadcasts live the first Thursday of every month. So make sure you check that out if you're in the Nashville viewing area. And it's where we answer patients' questions, and because their doctors are busy and their pharmacists are busy, and quite frankly, they don't have time, but for that hour, I do. Today's content is because that show is so busy, I'm answering questions the entire hour. So I want to put out a little bit of content. So in this video series, we're going to be talking about different herbal supplements that we don't normally get to talk about on the show. If you want to know who I am, I reside, born and raised in Nashville, Tennessee, a graduate of Tennessee State University, go Big Blue, a graduate of the University of Tennessee College of Pharmacy, go Big Orange. And if you're looking at the purple and gold and you see the brand, make no mistake, I am the Bruz. One Row Kappa, Spring 89, Q Show Dog #1, Physical 5th District. All right, so we're going to get into the content. Today we are going to discuss Garcinia Cambogia. So for those of you who are looking for a safe option for weight loss and something maybe to enhance your mood, this is the product that you're going to want to get. So let's just talk about it a little bit. So for those of you who are looking to safely lose weight, Garcinia Cambogia actually comes from a pumpkin type fruit found in Southeast Asia, or some parts of India. And the active ingredient inside of Garcinia Cambogia is hydroxycitric acid, or you may see it as HCA. So this is the ingredient in Garcinia Cambogia that's responsible for its pharmacologic benefits. So what are the benefits of taking something like Garcinia Cambogia, Dr. Pruitt? Well, first of all, it helps you lose weight by blocking fat production, and we'll get a little deeper into it. The second piece is it lowers cholesterol. The third benefit is indirectly, it lowers blood pressure. And then of course, the fourth piece is it enhances your mood. So let's get into those a little bit about what's going on with Garcinia Cambogia. Now, its fat blocking or fat loss benefit comes from its ability to inhibit an enzyme called citrate lyase. And what citrate lyase does is that once we intake carbs and sugar and all of those things, this enzyme breaks it down, converts it into fat and cholesterol and triglycerides. But what the hydroxycitric acid in Garcinia Cambogia does is inhibit this enzyme's ability to do that. And so once you get that going on, you're going to get decreased fat production. You're going to get less cholesterol accumulation in the arteries. And so this means that you're going to have a lower cholesterol. You're going to have lower triglycerides. And so for those of you who are on statins and you're looking for an alternative that won't give you the muscle cramping and the liver damage, Garcinia Cambogia may be something that you might want to look at. All right, and then the third piece is it indirectly lowers your blood pressure. Well, how does it do that? Well, you have to remember, if you have atherosclerotic plaque building up in your arteries, and it has all of this goo, there is a narrow passage for the blood to get through to your organs. And so your heart is having to pump harder. But once those arteries become clear, or those vessels become clearer, then the heart has to work less to pump the blood through to your organs and the rest of your body. So, decreased appetite, fat blocking, lower cholesterol, and the other piece is, so what else does it do to help me lose weight? Well, glad you asked. It has a direct effect on serotonin. And as you know, serotonin is our happy neurotransmitter. It's what keeps us in a good mood. It is what keeps us satisfied, when we're in such a good mood we don't feel like eating. So for those of you who have propensity to be binge eaters because you feel down sometimes, or because of the winter season and you just feel like comfort food just to feel good, this decreases the urge to binge eat because you're down. And what and I've taken this product too, by the way, and what I've noticed is, and I'm a fairly nice sized guy, when I take Garcinia Cambogia, now I can eat a large pizza by myself, no problem. Yeah, I can throw down. But when I take Garcinia Cambogia, my appetite is cut down to where I can only wolf down about 3 slices and I'm good for the rest of the evening. But my patients have also reported enhancement in mood. And when your mood is enhanced, you feel better, and it's a decreased propensity to want to binge eat. And it also has a liver cleansing metabolism type effect as well. So it's going to boost your metabolism, but for those of you out there who have hypertension, it will not raise your blood pressure. So we want to make sure that we get that out there. So what many people will do is they will take these fat burners and will wind up getting themselves in trouble in terms of their heart and their blood pressure. This is safe for you to take with hypertension, not only because it has lowering effects, but it does not increase your blood pressure. Now, let's talk about some precautions, because as you know, all supplements are not good for everyone. Certainly pregnant and nursing women, we would ask you not to take this supplement, certainly because of the effects with serotonin. Those can be passed down to the baby. All right, so we ask you to stay away from that. Those of you who happen to be on SSRI antidepressants, serotonin-specific reuptake inhibitors. So what kind of antidepressants are those, Dr. Pruitt? Those are drugs like citalopram, whose brand name is Alexa, Cymbalta, whose generic is duloxetine. Those of you who take Prozac, whose generic is fluoxetine, and those of you who take Zoloft, whose generic is sertraline. And so we would certainly either ask you to not take the supplement concurrently with them, or certainly use it in caution. Please check with your pharmacist or your prescriber before you begin to look at using this supplement. The other piece is we want to make sure that you drink plenty of water with this, and alkaline water is what I would probably recommend, because it's really going to go a long way towards flushing your body out. And the recommended amount of water is not 8 glasses a day, because we are all different individuals. It is half your body weight in ounces. So take your total body weight, divide it by 2, multiply times 30, and you will get the amount of alkaline water you should be knocking out a day. So for me, if I'm a 200-pound man, I should be drinking about 100 ounces. So 100 times 30 is 3 liters, which is roughly about 3/4 of a gallon. So this is Dr. Shawn Pruitt. Be sure to subscribe. Subscribe so you can get some of this good information. We're going to have many videos coming out about different supplements. And if you want to see my previous shows of Pharmacist on Call, be sure to put in Pharmacist on Call on the search box. And guess what? You'll see all the shows. I've been doing it for about 5 seasons now. So check those out, but be sure to subscribe to Pharmacist on Call, because we are going to have plenty of good content coming through this, because I can't do it all through my television show. Again, this is Dr. Shawn Pruitt, host of Pharmacist on Call, owner of Pruitt's family of pharmacies, and we will see you next time.